All right, let's jump straight into this explainer and tackle something that affects millions of guys, but is honestly completely misunderstood. We're talking about the reality of male hormone decline and the highly practical steps to safely treat it. We're going to break down the actual biology today, and then we'll even demystify the physical tools used in treatment. It's really all about moving from total confusion to absolute clarity. Here is our roadmap for today. Number 1, the hidden hormone drop. 2, identifying low testosterone. 3, normal versus optimal levels. 4, the injection toolkit. And 5, our step-by-step injection guide. Let me ask you something right off the bat. Do you think you're too young for a hormone drop? Well, we are going to completely shatter the myth that low vitality only hits men over the age of 60. It's such a common misconception, but the clinical data proves that younger men, literally guys in their 20s and 30s, are absolutely experiencing significant drops in testosterone right now. You really can't afford to just ignore this because of your birth year. Section 1, the hidden hormone drop, the timeline of male vitality. So, consider this timeline. Testosterone levels actually peak way earlier than most people think, right around age 20. From there, they begin this natural, gradual decline as you hit your 30s and 40s, and eventually they hit their lowest points at 60 and beyond. But here's what you absolutely need to understand. Age is not the only factor at play here. Your daily habits completely dictate the speed of this decline. Think about typical lifestyle drainers. If you're, living that standard couch potato life, scraping by on terrible sleep and a bad diet, or hitting the alcohol and tobacco hard, you are essentially pouring water on your own biological fire. You are rapidly accelerating this hormonal decline yourself. And trust me, it affects every single system in your body. And these lifestyle drains, they don't just lower some random number on a chart. They lead to highly disruptive physical symptoms. We are talking about a noticeable drop in libido, erectile dysfunction, a sudden loss of muscle mass and physical strength, a profound lack of daily energy, and even a persistently low mood. It just completely drains your overall drive to get things done. Section 2. Identifying low testosterone. Getting the right data. Now, this is incredibly important if you're actually going to get tested. You want to avoid the outdated medical practice of just calculating your free testosterone. The data shows that this older calculation method simply isn't highly accurate anymore. The modern precise practice relies on testing your total testosterone combined with your SHBG, which stands for sex hormone binding globulin. Getting both of these data points provides a much clearer, way more accurate picture for managing your hormonal health. Section 3. Normal versus optimal levels. Reading your lab report. Let's break this down for a specific age group. For a 35 to 39-year-old man, the standard cutoff range is often cited as anywhere from 352 to 478. But the optimal target should actually be above 400. We are completely tossing out the outdated standard that anything above 300 is perfectly fine. Think about it. If you're 35 and your levels are at 310, you might be technically normal, according to an old standard, but you are absolutely on the low end for your specific age. And here is a massive light bulb moment. Just because a lab report says your levels are normal, it does not mean they are optimal for human performance. You really don't just want to scrape the bottom of the barrel of a broad lab range. To actually feel your best, medical experts suggest aiming for the 50th to 75th percentile. You want that middle to upper tier. That right there is your optimal level. I love this quote from Dr. Tum because it perfectly encapsulates the modern medical approach to vitality. He points out that standard lab reports often have values that are simply too low to support peak wellness. It's kind of like insulin levels, right? A standard lab report might say an insulin level anywhere between 2 and 25 is normal. But functional experts know that once your fasting insulin goes over 5, it's already signaling a problem. The exact same logic applies to testosterone. You must target the median, optimal range for your specific age group, not just rely on the massive generalized lab range. Section 4. The injection toolkit. What you need. Okay, so if your optimal numbers are lacking and you've been prescribed ribuloma therapy, let's look at your complete, remarkably simple toolkit. Always start with thoroughly clean hands. You'll need 2 alcohol swabs, your prescribed bottle of testosterone, a standard 1 milliliter syringe, and crucially, 2 distinct needles, one for preparation and one for the actual injection. Now, if you are at all intimidated by needles, understanding this contrast is a total game changer. That large, scary, thick needle, you can totally relax. That is strictly for preparing your dose and drawing the liquid out of the bottle. It never touches your body. The injection needle, on the other hand, is incredibly fine, much thinner, and specifically designed to be easy and relatively painless when it actually touches your skin. Section 5. Step-by-step injection guide, from vial to muscle. Step 1, always use an alcohol swab to disinfect the top of the bottle. Next, attach that large preparation needle to the syringe, insert it into the bottle, and flip the whole thing upside down so the tip is submerged in the liquid. Here's a pro tip for you. Draw out just a little bit more than your prescribed dose. For example, if your dose is 0.3 milliliters, pull a tiny bit past that. Why? Because this allows you to confidently push any extra air or bubbles back up into the vial, perfectly lining up your exact dose. Once that's done, flip it right side up, withdraw, and carefully recap that thick needle without accidentally stabbing yourself. Next up, you just twist off the large needle and attach the fine injection needle. And hey, make sure you never touch the sterile ends while swabbing them. Then take your second alcohol swab and disinfect the injection site on your leg. Right before injecting, gently push the syringe until a tiny drop of liquid appears at the tip. This just guarantees there's absolutely no air left in the line. Now, stabilize your skin with one hand, and with the other, gently push the fine needle down into the muscle. Once the medication is administered, draw the needle out nice and easy. If there's a tiny drop of blood, simply apply pressure with a Kleenex or gauze for about 30 seconds. And that is literally it. It really is that simple and manageable. So, armed with the actual science of optimal ranges, the knowledge of how your lifestyle accelerates decline, and the practical relief of a completely demystified injection process, it's time to evaluate your own health data. Are you going to settle for just being normal on an outdated chart, or are you ready to take charge and reclaim your optimal vitality? The data's out there, the choice is absolutely yours.